Well, flu cases in our area have more than quadrupled in the first 3 weeks of November.
UW Health today reported 422 cases of the flu just last week.
That tops anything UW Health saw for flu cases in 2019 and 2020. UW Health Chief Quality Officer Dr. Jeff Pothof back with us once again with his weekly visit.
Hi, Dr. Pothof.
Good to see you.
Boy, this flu just took off.
Yeah, I think, we kind of knew it was coming. It was in Australia. It was the Southeast United States. We started to see some cases early November, and we're like, yeah, it's here. And then all of a sudden it's like, whoa, it's here. The numbers have just exploded.
Well, we haven't had much exposure to these viruses the last couple of years because we've all been trying to not get and spread COVID. Is that what's happening? Is that our immunity is a little bit lower than it normally is?
I think it's part of it because typically we would have a good proportion of the population would have exposed to influenza last year, the year before. But at the same time, a lot of us have experiences with influenza from before the pandemic. We should have had something there that would have, maybe slowed this spread. It could be a little bit about the variant that's out there. It could be also that we've been cooped up for 2 years, so we kind of just want to get out there and hang out with people, and that's maybe driving a little bit of this too, but numbers are up.
But so far people aren't being hospitalized with this.
Yeah, if there's a silver lining, at least at this point, it's still early, but we're not seeing a lot of hospitalizations going along with that. And then likewise, when you look at the conversion rate between people who get influenza and then go on to be hospitalized versus people who have COVID and go on to be hospitalized, it's much lower with influenza. So we won't see these huge spikes like we saw with COVID surges, but we probably will see some increase in hospitalizations with influenza over the next several weeks.
And if you get the flu vaccine, does it protect you immediately or does it take a little while?
So it takes a while. Think of it just like a COVID vaccine. It takes about 2 weeks to build those antibodies. And the influenza vaccine never was like super 100% effective against stopping symptoms. It can do that. But its real benefit is in reducing the severity of the disease that you get. So if you get a vaccine and you get the flu, the right comment isn't, hey, I shouldn't have got the vaccine. It didn't help me. It's like, wow, I wonder how bad this would have been if I wouldn't have been vaccinated.
The same thing with COVID.
Yeah.
COVID vaccines.
Yep.
I read some things of a new possible variant in COVID.
There's actually a number of different variants out there now. Now, they're all like sub variants of Omicron, so they're not particularly new, but I think there's like 10 of them out there right now. There's 3 or 4 that are making up a higher percent of cases, but so far what we're not seeing is a significant increase in hospitalization, a significant decrease in vaccine effectiveness. So none of these variants so far are making a big difference in that. They do kind of foil with some of our therapeutics we have, the medicines we use to treat COVID. They make some less effective, but for the most part, more variants out there, but nothing that's hugely consequential yet.
Boy, the symptoms of COVID and flu are so similar. If you go to see a doctor, can they tell that it's the flu?
Yeah, no.
And not COVID.
There's a test for flu.
Yeah, you'd have to test. So if you did the test, you would know, COVID, influenza, or something else. But especially early on, when you're first kind of getting those symptoms, a lot of those symptoms overlap. So, whether you have fever, cough, sore throat, headache, muscle aches, fatigue, COVID and influenza both have those. So there's really no way you could tell whether you have flu or COVID unless there was a test.
So just stay home if you don't feel well.
I think that's a great advice. I think we all know this. It's just really hard to do because it's inconvenient. It messes with our lives. But if you are sick and you're like, should I go to work? Should I not? Should I go to Thanksgiving? Should I not? If you're having that conversation in your head, the answer is probably you should not.
Now, will you be watching the COVID numbers quickly post-Thanksgiving to see, because this is the first time we have all really been back together again.
I think it'll be interesting to see what happens because in previous years we had a lot of COVID in the community, so we knew that Thanksgiving would definitely increase numbers. COVID is still in the community at a lesser degree. It'll be interesting to see when people get together what kind of increase in COVID that causes us to see. I think less than we've seen in previous years, but I do think we will see a little uptick here in the next couple weeks.
And when does the flu typically spike?
Yeah, so in most years, January, February would be where it would spike. There's usually a slow trickle from about Thanksgiving on to December, increases middle of December, stays high through kind of January, February, and then quickly drops off.
All right, get the vaccine.
Yeah, if you haven't, do it right now.
Jeff,
thanks, Dr. Pothof.
Thanks.
Great to see you.
Appreciate it.